All right, looks like it's showing up, which is great. Welcome everyone to the December information session for the MS in Health in the Public Interest Program. We're really excited to have all of you here with us today and excited to have a special guest alum from last year, Michaela, on with us as well. We'll jump right into introductions so we can introduce her and the rest of our team. And of course, at the end, we'll leave plenty of time for any of your questions. So first, here's a little bit of what today will look like. We'll introduce ourselves and our roles within the program. We'll talk about the program itself, why HAPI kind of takes a different approach to public health and versus an MPH program. We'll discuss career opportunities in the field, what alumni have gone on to do afterwards, and we'll look into an admissions overview, what to expect when submitting an application. Well, of course, at the end, leaving plenty of time, as I mentioned, for all of your questions. So first of all, let's introduce ourselves. My name is Jenny Jansen. I use she, her pronouns, and I am the program coordinator for this program. What that means is I help support graduate students from application to graduation through recruitment and admissions support, academic advising, and other various programmatic needs. As such, I am a great resource for questions about the program at large or application logistics, because those are all the things I happen to handle. I will pass it off from here to one of our program co-directors, Dr. Adam Myers.
Hi, good morning. Thanks for joining us today. As Jenny said, I'm Adam Myers. I'm originally a basic scientist at Georgetown University School of Medicine and the Graduate School. In maybe the last 10 or 15 years, I've become more and more interested in factors that affect our health and our society beyond the basic science things that I studied in the lab. And I'm real happy that we're now in the 8th year of the Health in the Public Interest Program, which we refer to as the HAPI program. And Dr. Fu Berman, who you'll hear from in a second, and I are looking forward to the 9th year starting in August this summer. So Dr. Fu Berman.
Thanks. I was just thinking that you're the one who came up with the great name, the HAPI program. It's the best name program. So I am Adrienne Fu Berman. I'm trained as a physician and have been at Georgetown more than 20 years. And I co-direct that HAPI program and also I direct Farmed Out, which does research and education on how the pharmaceutical industry manipulates prescribing habits. And some of the HAPI students have done internships or internships or capstones with me. Okay, next.
Excellent. Before we move on, Michaela, I'll pass it to you to
Oh,
introduce yourself.
sorry. Michaela.
Hi, everyone. My name is Michaela. I'm part of the class of 25. I just graduated in May, and now I am working for Fairfax County government under one of the district supervisors.
All right, amazing. Thanks so much. We're happy to have you on today. Great. I'll pass it back to Dr. Fu Berman to talk a little bit about the faculty that help make up the program.
Yeah, so these are the program starts with this kind of social sciences boot camp in the summer, a 3.5 week social sciences course that is directed by Dr. Dutton, who's a cultural psychologist. So it's a specific subspecialty of psychology, and then it's also taught by an anthropologist and a sociologist, and that gives everybody a really great foundation in social sciences. That particular course, the first course, which is late summer, is online to give people a chance to get to DC and get settled. And then Dr. Sherman teaches nutrition electives, and Dr. Golding teaches our health communications course in the spring, which was not a course that we had originally, but we added in because students really wanted a health communications course, and that's a great course. Next. Donnell Harvin is teaching our theory and methods of epidemiology course. So it's kind of a two-part course, the more quantitative. It's not highly mathematical, but the more quantitative part is in the fall, and then this qualitative part is in the spring. Dr. Marver teaches our biology of health and disease course, and Dr. Turbat teaches our health economics course. So Pam Saunders teaches our the second part of the theory and methods course, so the more qualitative research angle in the spring, and Dr. Weinstein teaches
And elective.
various courses, international health, and what else, Adam? What were you saying?
I guess that she teaches electives that a number of our students take
Mhm.
as a demographer and social scientist.
Yeah, very well known. Next. I think
Okay,
someone
so I can take over here. So a little bit about Georgetown. You've probably seen by now that it's a Jesuit university, and I'll get back to that in a moment. But at Georgetown, we have a vibrant community of students, faculty, and alumni from a range of backgrounds and insights and experiences. And the courses in our program are focused to blend study with real world experiences to develop your personal and professional capabilities. So you'll have opportunities to apply what you learn and become a thought leader in your community through many of the activities that you'll see as we go over the curriculum and what the program is all about. So Georgetown, as I said, is a Catholic Jesuit university. It's the main offshoot of this, as far as our program is concerned, is that Jesuits are an order of Catholics who are very much interested in education and development and care of the whole person. They leave a lot of space for us to introduce values to what we teach. It doesn't specifically push us toward anything that's specific to Catholicism or Christianity. We have a kind of a non-denominational view of the world, but steeped in the Jesuit educational and professional values. So why the HAPPY program? A lot of people ask us, what's the difference between this program and a public health program? And I think you've caught on that much of the coursework is similar to what you get in a public health program. You take a course in health communication. You'll take some courses that have to do with advocacy and statistical methods and epidemiology, et cetera, just as MPH students do. But our program specifically is looking for people who are interested in the intersection between social factors, non-clinical factors, and health. So we're not interested in training people particularly to fit into the existing scheme of our healthcare system. We actually think that the system is in dire need of reconfiguring, and I think almost everybody would agree with us at that point. But we want to train people who will go into this arena as change agents, as people who want to make it better. And so we have this list of core courses that is similar in many ways to a MPH program, but doesn't emphasize the technical aspects so much as the social determinants of health and what we can do to incorporate a more overall health-oriented scheme into healthcare, which is now driven, in my personal opinion, mainly by money and politics. Next slide, please. So do you want to start? Who wants to go here? Jenny?
Sure. All right, I'll talk a little bit about the program at large before we dive into kind of what class schedules look like. As Dr. Myers kind of mentioned, our goal is to teach you to be a caring advocate for a rational healthcare system and rational health policies, and to understand this whole spectrum of non-medical influences on health, while also giving you room to kind of grow and specialize in the area of your choice. We don't have official concentrations in our program, but we do give you a lot of opportunities from 6 elective credits, which is roughly 2 classes. to our seminar series where you meet weekly with different public health leaders via Zoom to find the places that really drive you in public health and figure out how to get connected within those communities. So it is a 30 credit program. It is a year full-time, roughly 12 months. And there are also part-time options. Typically, students complete it in 2 to 3 years part-time. But of course, if your schedule varies a bit more, we are happy to kind of talk with you. And we've had students go longer than that if that's the best path for them. The total tuition rate is approximately $63,000. This is a discounted rate, which we negotiated with the graduate school based on their belief in the mission of our program. However, do note that this is the current tuition rate. Tuition rates rise every year across Georgetown, and the 2026 tuition rate is pending approval by the board of directors. So we're hoping to find out more about that in the spring. Typically, it is increased at most 4% each year. So that's a good way to estimate costs if you want to try and think about what you'd be paying next year. And another thing to note is while there are 2 elective credits, if you have a significant background in biology, say if you just took a biology course in your undergraduate study, you may have space for an additional elective course for a total of 3 elective courses, since that course is kind of designed for people with less of a science background to catch up before we start talking about other kind of non-medical factors in health. Great, and I'll pass it back to Dr. Myers and Dr. Fuberman to discuss the full-time and part-time schedules.
So sure. So I already mentioned the summer course that is online in August to give people a chance to move to DC. That's Health, Disease, and Society. And then here's the schedule for the fall course, Health Advocacy. I teach that. That's a very immersive course that's different every year. Biology of Health and Disease is really designed for people who don't have a strong biology background. We get people with literature degrees and other humanities degrees, and we want them to be able to discuss diseases, at least common diseases, and to know about them. It's actually been a really popular course. It's team taught and is a really good course. Dr. Myers will talk more about seminar, which is also like a shining star of our program. And I think I've mentioned these other courses. Seminar is both fall and spring, and then there's a capstone or internship that is also required in the program. Usually, students do that the second summer, so you can complete the program in 12 months if you do the capstone in the second summer. Some students have done it part-time over a longer period of time. Some students have done it the following fall. So it's somewhat flexible. It's got to be about 240 hours, so about 6 weeks full-time, but it can be 12 weeks part-time or something like that. So there is some flexibility there. And that's also a course that I direct. We have lots of contacts in places that you might want to work, and often students find their own as well. Next. And this is a sample part-time program for students who want to do it over 2 years. You do have to start with Health, Disease, and Society, even if you're part-time. So that has to be done, and it's difficult to work while you're taking that course because it's very intensive. Next.
Also, Michaela, if you have a favorite class you kind of want to mention here, we'd love to hear from you.
Are you on mute?
Sorry, I forgot to unmute myself. Yeah, it's hard to choose. I really enjoyed so many of the courses. But I feel like I like them for different reasons, just kind of briefly. Seminar was really great because I think it really helped me develop my like public speaking skills and just kind of helping moderate conversations. I just thought that was really helpful, and also a really wide range of topics. So I just really thought that was super interesting, and a lot of opportunity for student input too on the speakers. So really enjoyed that. Health advocacy was also great because one of the assignments was to attend like a public hearing of some sort. So I actually went to the Hill and saw the committee hearing on pricing for Novo Nordisk products, so like Ozempic and Wegovy, which was really cool to see that in person. Yeah, and then also health econ I thought was really cool as well. I had an econ undergrad degree, and I just really liked kind of seeing the overlap of different health topics and economics and just kind of how that plays out. So yeah, I would say those are probably my top three, but again, so hard to choose. I really enjoyed all the classes for different reasons.
Awesome. Thanks so much for sharing. Now we'll talk a little bit about electives and how those differ from core courses.
There's a wide variety of electives that are available, and they can be taken in different schools. So these are just some examples. Medicinal plants is a class that I teach. Happy students used to take that more. I haven't had any happy students in that class for a couple of years. Some students have even taken courses at the law school. So there's a wide variety of elective courses that can be taken in a variety of departments. Not every course is available. So some are, limited to people within certain courses of study. But there's a lot there's a lot of options for electives.
Great. And Michaela, if you want to share one of the electives you took too, feel free.
Yeah, I took bioterrorism in the fall, and that was really interesting and really different from I think anything I've ever taken before. So I really liked kind of putting that class in there and kind of expanding my horizons on that front. And then the other one I took was economics of the social sectors. So it was, and by social sectors, they meant like health and education. So that was also really cool. Yeah, and I really enjoyed both of them.
Awesome.
And so the capstone project, there's all kinds of things that people do as capstones. So the students can go to work in an NGO, non-governmental organization. They can work in government. There's NIH internships and a lot of internships at government agencies, including city government. Some of them have done independent projects. Some of them have done international projects. So these are just some examples of capstone projects that students did. Michaela, do you want to talk about your capstone?
Yeah, I ended up doing my capstone with DC Health specifically in the HOSTA office, which covers HIV, AIDS, and TB. And that was really interesting. I kind of came upon it was through actually one of the seminar speakers that he was speaking on his experience there, and he ended up connecting me with a former colleague, and that's kind of how I got started there. Yeah, it was really interesting. I made flyers advertising different types of medications and therapies that they did at the clinic, as well as looking through Ryan White eligibility. So basically, like who can get help to pay for HIV medication. So yeah, very cool stuff.
Oh, amazing.
So the seminar series is one of my main spots where I interact with students in the program. And it's really a lot of fun for me to do that. And I think that the students enjoy it a lot. We make this very much a student-centered activity. Students are involved in suggesting seminar speakers, in developing an introduction for particular talks, to moderate the series, and to moderate the talks, and then to have a discussion around the talks on the Canvas, which is you may be more familiar with some of the other courseware like Blackboard, but we use Canvas. And so it's an opportunity for students to learn more about a topic of their choice. We didn't really get into this much, but the program, through the seminar series, through electives, and through selection of capstone projects, et cetera, through a lot of mechanisms, it allows students to, although we don't have specific areas of emphasis that are listed, students can develop their own. Oftentimes it's something in the area of reproductive or women's health, race and medicine, anything that you're particularly interested in potentially following up in your career or further education. So we started out with an in-person seminar series, and during COVID, we discovered that the seminar actually works much better as a virtual activity. And that's because, for one thing, our students don't have to come to campus for a 1 hour talk that's maybe not on the same day as some of their classes. Seminar speakers can give a talk without traveling to DC. There's a lot of reasons why it works better on Zoom than it does in person, and not the least of which is that we've developed a international audience of people who shore up the attendance of these seminars. So it's always at least a couple dozen, and sometimes much more than that. And you get a chance to interact with audience members from all over the world, or especially all over North America. And so some of the great seminar speakers that we've had, that some of them are shown here. But I was thinking last night, I was watching CNN News, and I saw Donnell Harvin, who teaches one of our courses and also gave a seminar a few weeks ago. And I thought back, and just in the last year or so, this year, we've had I've sat in the same chair and watched Peter Lurie and Peter Hotez and Donnell Harvin on CNN, some other folks on other news outlets or special programming. And it's just a reflection of how well this thing works on Zoom, and what a rich educational environment we can provide this way. So it's really the highlight of my week, and I think it's a high point for all of the students. Next, please.
And Michaela, since you mentioned being a big fan of seminar in particular, did you have any favorite seminar talks from your year in the program?
Let's see, I'm trying to think. I really went into all the seminars and enjoyed all of them. But yeah, let's see. I would probably say Adam Visconti, honestly, the man who worked at DC Health. I just really liked hearing about his experience and just kind of his, yeah, just incredible background and variety of jobs he's worked.
Yeah, so that one actually centered on reproductive health and sexually transmitted infections and HIV/AIDS. So another area that a lot of our students are interested in. And he was selected on the basis of a student suggestion as well. So this slide shows some of the career paths of our alumni. We've had well over 100 alumni at this point. And as you can see, it represents a fairly wide swath of governmental and non-governmental organizations, research organizations. Some people go into further education, either through a medical or a legal route. We had one student do a PhD in epidemiology. Another student decided that she wanted to go into more direct work with patients, and went on to study social work and received her MSW at Columbia. So this program really opens up a lot of possibilities. And I talked briefly before about how this program compares to an MPH program. And this is a good point to think about as well, is that when you're looking for positions, you don't see very many positions at all that say that an MPH is required. They're looking for people that have specific experience related to public health and special areas within that. So this program can, as you see, get people eventually working in a lot of different organizations related to the health world. Next, please.
Michaela, can you talk a bit about where you're working currently and what that's like?
Yeah, so I work for Fairfax County government in one of the supervisor's offices as a health and human services aide, and I also cover the office's housing and arts portfolio as well. And it's a lot of constituent services, but also kind of event planning. Like I'm about to plan our district's health fair. We'll have a bunch of different health services like blood pressure screenings, vision screenings, hearing screenings, and then also just resources on vaccine information and stuff like that. So yeah, it's been kind of like um, it's been a great job just because we have a lot of different roles, and I guess kind of, anything the office needs done, I can kind of step in. But yeah, it's been a really great introduction to kind of health policy and just kind of using my degree in the job sphere. So it's been great.
Great, that's amazing. All right, so now I will talk a little bit about admission to the program, application logistics, and what you should expect when applying to the program and trying to finance your degree for the program. First of all, here is a handy application checklist. It's a good thing to screenshot, but also all of this is available on our website, Prospective Students tab as well. First off, you'll need a completed application form. This is done on our website. You click the Apply Now button, or you do gradapply.georgetown.edu, and it'll take you right there. Next up, you'll need an application fee. This is waived, however, before January 15th, so this is a great time to be thinking about applications because exactly a month from now, up to then, it is free to apply to the program. Afterwards, there is an application fee of $90 required to submit your application. Next up, we require a approximately 500-word academic statement of purpose. This is where we see people discuss their academic journey, what brought them to apply to the program, what they hope to get out of it, and personal goals. We really like to see just kind of people's clear interest in public health at this point. You don't need to have an idea of the exact type of job you'd like to have, but just seeing that you have passion in the arena of public health and you kind of have a critical eye towards it is really great. We also do strongly urge applicants to fill out the optional personal background statement, which is approximately the same amount of words, and it gives you an opportunity to expand on your personal background and experiences and how they contribute to your interest in the field. This is also a really great way to show that you'll be an active contributor in our community, because that's something you'll see is very key in both our coursework and just kind of all our other interactions, from health advocacy to health communication. There's a lot of sort of hands-on out in the field projects for students to take on when it comes to advocacy in the public health field. Next up, we require a writing sample. This is just 1 page or more, and it is used to assess your preparedness to write at the graduate academic level and perform critical analysis, which is a key component of happy education. As such, this does not need to be tailored to the application. It could even be something like an English paper. That's perfectly fine. But we do, of course, like to see things that are kind of related to public health as well. Most commonly, students submit research papers or capstones from their undergraduate degrees, but we also welcome professional papers such as op-eds and technical reports. When you are doing your resume or curriculum vitae, you'll submit that as well, and 3 letters of recommendation to the program. If possible, try to have at least one of your recommenders be an academic you've worked with, such as a professor. You may use responsible individuals from a work environment, like a boss or supervisor, but it's great to have one from an academic because that gives an idea of what you're like in the classroom for us. Right. That is also managed through the online portal. So for recommenders, you will enter their names and emails, and they will receive emailed instructions on how to complete the recommendation. You can also send recommenders reminders and check the status of their submissions through the portal. Another good thing to know there is we do not require you to submit the letters themselves by both the priority or regular deadline. There is approximately 1 to 2 weeks after that where recommenders have time to submit their letters on your behalf. So if you don't have the physical letters, but you know you have a recommendation coming on January 15th and you want to submit your application, that's perfectly fine, and we will consider it submitted. Next up, we require your unofficial transcripts. Of course, we will eventually need your official transcripts before the start of classes in order to ensure that you're ready to move on to graduate study. But unofficial transcripts are fine to submit by the state, and we are definitely familiar with students who are submitting to the program when they haven't completed their undergraduate degrees yet. So perfectly fine if you're still currently working on a degree and you're in your senior year of undergraduate study. Finally, if you did not attend a school where English was the primary language of instruction, we will need a test that demonstrates English language proficiency. You'll see on the right in that bottom blue box the minimum scores on the two types of tests we accept, the TOEFL and the IELTS test, to be considered eligible for admission to the program and proficient in the English language for the purposes of Georgetown instruction.
Before you
Next
move
up.
on, I have a quick question.
Yeah.
For the writing sample, is there a maximum number of pages? Like if we're submitting a research paper, should we choose like a 1 or 2 page excerpt, or is it better to submit the piece in its entirety?
We will definitely accept the piece in its entirety. Dr. Fuberman and Dr. Mars can talk a bit more about if they have any length preferences when reviewing, but more than 1 page is perfectly fine. We've definitely had full papers submitted to us before.
Thank you.
No,
Yeah, we
that's
can-
totally fine.
Yeah.
Great, excellent. All right, I'll talk a little bit about admissions eligibility criteria since we got into that on the last slide. First, applicants must hold a bachelor's degree or equivalent from an accredited institution. So this should be equivalent to 4 years of undergraduate study in the United States. Sometimes if you're an international applicant, it can help to have a WES credential evaluation because that will sort of translate, so to speak, your transcript to the US system so we can tell if you are indeed eligible for admission. As we said, this is a program where we're very passionate about different things in the public health field, and you'll interact with a lot of people who are really looking to make change in different sectors of the public health world. So demonstrated interest in public health related fields such as healthcare, health equity, reform, and advocacy are all very strongly preferred. And any way you can demonstrate all of those interests in your application is excellent. Finally, we require a minimum grade point average of 3.0 on a 4.0 scale to be considered eligible for admission to Georgetown University. With this being said, however, we do conduct a holistic review of applications. We have a small cohort size, and we do want to really get to know our applicants and what draws them to the program. So if you are concerned about any of these eligibility requirements, but feel you are otherwise a very compelling applicant, we do encourage you to reach out to us via our program email, HAPI or happy@georgetown.edu, or me directly, because in some cases we're able to make successful appeals for students who may not meet one of these criteria to be admitted to the program. Right, before we go to questions, I'll talk a bit about deadlines and financial aid for the program. First of all, that priority deadline I mentioned also comes with priority merit aid consideration. So also a good reason to be shooting for a January 15th submission. That deadline, January 15th, and the application fee is waived. We will review applications on a rolling basis until our final deadline of April 1st in 2026. That comes with an application fee of $90, and we do encourage you to say that you're applying for fall 2026 because our August session is a fall pre-session and not a summer course. All right, so now finally a little bit about financial aid. This program offers limited merit-based scholarships for competitive applicants. All applicants are automatically considered. There's no need to submit any additional materials in your application, but we do strongly encourage you to apply by the priority deadline of January 15th in order to get full consideration. As we mentioned, the tuition for next year is not confirmed yet, but it's likely a 4% increase to last year's rate of approximately $2,100 per credit. The majority of students in the HAPPY program have financed their degrees through multiple sources, such as merit aid, benefits from their employer, and outside external fellowships and scholarships. We recommend looking for external funding sources earlier rather than later. Typically, a good amount of deadlines occur in October for the fall of the following year. Places that are good to look are ProFellow and Scholarships 360, and the Office of Graduate Studies has a dedicated webpage on tips and deadlines for applying to outside scholarships and fellowships as well. Sometimes they'll also feature Georgetown internal scholarship opportunities there. So that's a good place to regularly be checking. Office of Student Financial Aid also has more information on financing Georgetown degrees, as well as more tips on applying to external scholarships. If you are eligible for Veterans Affairs benefits, make sure to contact the GU Veterans Service for more information on starting that application process. And graduate students who are domestic applicants are indeed eligible for the free application for federal student aid or FAFSA. So we definitely recommend filling that out since it's free, and you may be found eligible for federal low interest student loans and or federal work study status. Speaking of work study, whether or not you have federal status, you are welcome to work at Georgetown while studying at the university. You can work up to 20 hours per week while pursuing a Georgetown education, and it's a great opportunity to work in different units and departments and see what they're doing on campus. There are also research assistant and teaching assistant jobs. They typically have a slightly higher hourly rate because they're subject to a collective bargaining agreement with the university. However, they do not come with additional tuition or residency housing benefits like some other universities, so that's a good thing to know. Graduate Career Center also offers a number of resources for finding and applying to scholarships, as well as support for enrolled students applying for jobs. And as a reference, if you're outside of DC, the minimum wage in DC is $17.95 for non-tipped workers, and typically graduate students at Georgetown make more like 20 or more dollars an hour. So good to know. And finally, the Georgetown Office of Revenue and Receivables offers monthly installment payment plans through their office. Once you get your first tuition bill from Georgetown, which is typically billed by semester, then you can go into the portal and change your payment plan if you wish to do so. All right, so that was a lot of talking. Thank you everyone for joining us today. We will now pass it off to all of you. Feel free to type in the chat or use the raise hand function if you have additional questions. And I see there's already two, so I'll look into those quickly. Yeah, we already asked about a maximum number of pages for the writing sample. And should we only include publications if we are the sole author is a great question.
Yes.
So yeah, and a very common thing that people put in is a senior thesis or honors thesis, also a term paper for a class. We're not looking to make you sit down and write a paper specifically for us. We want to see an example of work that you did yourself and wrote yourself, usually for some other purpose before the program.
Yeah, but if it's co-authored with other people, we can't tell what you contributed. So it should be something that only you wrote.
Yes, you are welcome, however, to sort of list those in, say, an accolades or publication section of your resume if you still want to show and discuss that research. Right, any other questions? Feel free to use the raise hand function or type in the chat if anything else comes up.
So Nicole, do you want to address the question directly on verbally?
Yeah, so my background, I've been a nurse for the past 6 years. And I've seen directly how like policies and regulations have directly impacted patient care. And I was just wondering, I'm more interested in like going into policy. So I was wondering like where you've seen like graduate students like go into like policy, and specifically if they need more of a JD or if this program will help them like directly influence.
Yeah, we've definitely had students go into policy. You know, it's not a health policy degree. There are electives in health policy, but you'll learn a lot about health policy. You know, you'll get a backing in health economics. You'll be able to understand the epi concepts. You'll be able to like combine that with your nursing knowledge. It'd be a really great combination. You know, we're really trying to train people to like learn about what's effective advocacy for changing health policies. So it's not directed so much at learning how to create health policy as it is about changing bad policies or fostering good ones. There's so many bad things going on right now. We're just like really busy. But anyway, what are effective ways to advocate advocate for public health is what we're going for.
Yeah, and if I could add to that, so getting involved in policy can happen in a lot of different ways. I mean, you could be a staffer for a congressional committee, you could be working for an NGO or some other non-governmental organization, people in state and local government. And in fact, public policy, typically people who work in the area of public policy aren't necessarily required to have a degree in public policy. So it's really the sum of all of your experiences and education that'll qualify you for those jobs. And as Dr. Foote-Berman said, people with clinical experience are very highly regarded in that world, because many of the people who are working in policy never really had a course in clinical science at all. So that's a great starting point.
All right, thank you for that question, Nicole. Madeline, do you still have your hand up from earlier, or do you have a new question?
I have a new question. In the beginning, it was mentioned that I think it was the Health, Disease, and Society pre-session course was difficult to take while working because it's more intensive. Could you give some context as to what that course entails? Is it one of those weekend courses where it's all included in like a short period of time? What about it makes it difficult to do while working, and is it possible even though it's difficult?
It's very concentrated. So I think it's like 3.5 hours a day, and then there's homework at night. And Michaela, maybe you can talk about that. But we've had students work part-time while they're taking the course, and that's been possible. We had, I think, exactly one student who was working full-time. She got some dispensation on her hours, but she was working full-time while she did it, and she said it was really, really hard to do that. So most people will take a few weeks off or like negotiate a part-time schedule if they're working full-time during that time. But Michaela, can you talk about like the level of work? Because there's homework every night, right?
Yeah, there was homework every night, and the classes, yeah, I want to say were like 3.5 hours, kind of in the center of the day. I want to say, I don't actually know when it started, but I want to say it was like 1 to 4 or something like that. But yeah, I worked part-time as a waitress. So like the shifts, I was able to kind of work around the class schedule. But yeah, I think it would definitely depend on what the job was.
Yeah,
And-
and regarding time, it is a 3-week program, so it is more of an extended time than a weekend, and typically classes are Monday through Thursday. So it's kind of a 3-week intensive course for students, which is why
That was going to be my next
sometimes people have
question. Was
issues
how
there.
many weeks? Thank you.
No problem. Great. And Elvis asked in the chat, how long is the full duration for the course? I'm assuming that means the kind of entire program. And is there one intake every year? The full duration of the program is approximately 12 months if you're taking it full time. And yes, we only accept one cohort per year. Everyone starts with the fall pre-session in August.
And that's usually right around August 1st or 2nd.
And I think once we had someone like take the fall course and then start in January, but that was really unusual, and it really is a progression. So it doesn't really make sense to do that.
Any other questions, comments about the program or admissions?
I have a quick question. Are all of your classes during the day, or if you're part-time, does that change the timing of the courses at all, or are they all during the day?
We try to make them towards the end of the day to accommodate the students who are working full time. Most of the classes are not actually in the evening, but they're mostly after 4 o'clock or so, except for seminars at noon, but that's during lunch hour and is virtual. Yeah, we try to do that. We can't always do it, but yeah, and there aren't multiple, there aren't multiple sessions because with such a small cohort. We're normally only about 12 to 15 students.
Thank you.
No problem. And Olivia asked if it's possible to defer entry. Once you're admitted to the program, you are allowed to request a deferral of entry. But in this case, we can't guarantee you would be offered the same merit aid package the following year if you were offered one. And you can only do so for up to 1 year. So that's not something that can be extended a second year. If you wanted to defer admission 2 years, you'd have to reapply again, like normal. No problem. Any other questions?
Or any specific questions for Michaela? She's the real expert.
All right. I'll put up our contact slide for anyone who has any additional questions, and then we'll check the chat again. But thank you everyone for joining us today. Feel free to call us via our phone, contact us via our email, happy@georgetown.edu. If you have any specific questions about the program, if you want to coordinate a tour of campus, meet with students or faculty, get connected with them, that can also be online, of course. Or if you'd like to sit in on a course in the spring, we're going to be kind of winding down courses. We're actually in final exam season right now. But we will be resuming courses in early to mid-January for the university. And yeah, we offer a lot of kind of opportunities like that to either be on campus or be virtual and get to know things. And of course, seminar is actually open to the public. So that is something you're more than welcome to attend any Wednesday. Make sure to follow us on our Instagram and our LinkedIn to see our weekly seminar announcements if there's a topic that interests you. That's a great way to actually meet students who are on that call and get a sense of the actual kind of instruction and fields and places of interest that our program is looking at. So yeah, feel free to contact us in any of those ways if anything additional comes up. And yes, that is a good question, Madeline. Most of the classes are on the main campus, Hilltop campus. That is where we're currently located, although yes, some programs are moving downtown. So say if you took an elective somewhere like Law Center, that would be likely on the law campus. Or if you took an elective at the School of Health, that would probably be at Capitol campus. But our core classes are on the main Georgetown campus.
And there's also a transportation system that can get you to any of the major sites where Georgetown offers classes.
All right.
It's great
Thank you,
talking to
everyone.
everybody today.
Yeah, thanks for joining us today.
Thank you. Thanks for joining us.
Feel free to reach out if you have any additional questions.